Patients who go for dialysis service at Lira Regional Referral Hospital face challenges of inadequate space to rest, where to sleep as they come from far places. Even the staff who attend to the patients are very few. And in the hospital, there are only 5 machines that serve many patients who come from Lango, Acholi, Karamoja, and West Nile, making the cost of accessing the dialysis machine high. Patients are charged 80,000 shillings per session on dialysis machine, and each session is 4 hours. Phillips Okidi, kidney patient from Agago district, says in his third month of undergoing dialysis service, he has realized that in the whole of the Greater North, the number of patients who come here are many and are from far places.
That is the cost of every session is relatively high because sometimes you don't only have to buy the bloodline, which is 80,000. They may require you to go and do some tests in the MBA. Their test, which is 125,000. So if it is a day, you have to buy the line, you have to do that test, and you have to keep buying drugs to supplement the dialysis process. So the cost is relatively demanding because every session you have to spend money.
However, patients, especially pregnant women who are attacked by malaria and their kidneys are damaged, and others are as a result of snake bites that damage their kidneys, so they do not pay for kidney services. Alice Alupu, a nurse at the facility, says 100% of patients who go for dialysis service with acute kidney injuries recover between 1 week and 1 month.
These are the ones I told you earlier on that they are the clients with acute kidney injury, the ones who have got preeclampsia, the ones whose kidneys have been damaged due to malaria, the ones whose kidneys have been damaged due to snake bites or poisoning. Those are the clients we do not charge on daily. It's a life-saving procedure, and therefore we do not want to waste time on waiting for the family to sit for a family meeting and do what. Yet some of these clients actually brought unconscious, and we feel if we delay, we may lose them. So we have tried to stretch for the arm of meaning the government has tried to stretch so hard to make sure that these particular clients whom we have hope in recovery, they do not have time to sit for the family and wait and maybe at the end of the day lose life because of finances. So the government has tried so much to give us these lines so that we give them in usually 1 week. Some of them recover actually. In 1 week we declare them free, others go in for 1 month. But the good news is that 100% of the AKI cases, which are meaning acute kidney injury, they have recovered very well and they have gone back home and they have given reasons. They have got more reasons to thank God.
Semi Ayugi, a resident of Kamdin in Uyam district, had the malaria attack. During pregnancy, she was put on a dialysis machine and she is steadily recovering.
I first stayed in Atapara, call it a Bear John Paul II hospital, whereby I stayed there and I was operated, found out that the baby inside the womb was dead. So when I came to the original referral, I had severe edema where the whole body was swelling. And then after that, I was put on dialysis machine. Now the fluids that was full on the body started reducing, and I'm quite feeling better. So when I came, they told me I had a problem with the kidney, whereby they started putting me on the machine, and they told me when I'm put on the machine will remove the waste in the body and I'll feel better. So when I came here, I was only told to pay the catheter that was used, but I'm not paying any other money, like for dialysis, like other people or any other thing.
Emily Musimeta, The in-charge dialysis unit at Nairobi Referral Hospital says they are making 2 years in service and they are proud of the achievements. Emily said that when patients go for dialysis services, they assess for very many things, including an
It comes on the machine for 4 hours per session. A session is 4 hours, though it can also go up to 5 hours. And how much to remove depends per patient according to our assessment. Some patients we can remove more liters, others we remove less liters according how they are. When a patient is put on this machine or when the doctor diagnoses you with chronic kidney disease, it is for life. Usually when you have to keep coming on the machine at least 2 to 3 times in a week for the rest of the life.
The unit has for the last 2 years attended to 5 pregnant women who come from mainly from Kole, Uyam, one from Teso sub-region, who came with an acute kidney injury condition of malaria. Some of them present conditions with high blood pressure because of their pregnancy state that lead to a failure kidney. Eat the right food, do more exercises, we can prevent hypertension, diabetes from coming. We prevent several infections that would insult our kidneys and eventually will lead to their failure. We need to live a healthy lifestyle that promotes the health of the kidneys. Running a dialysis is very expensive. Other places the cost is quite high. Others you can spend like 1.5 million shillings per week.
2 to 3 times in a week for the rest of the life, for the rest of the years you're remaining with, unless you have a chance and you have a kidney transplant, which is a bit expensive and the process is a bit lengthy. But for those who have benefited, if you have a transplant, then you relax from the dialysis.